everyone. This is James Braithwaite. I'm not at the offices of Yorkville Physiotherapy today. Today we are at the Yoga House, which is a yoga studio here in Toronto, and this is the proprietor of the Yoga House, Celeste Shirley. Hi, Celeste.
How are you doing?
Nice to see you again. Yeah. Celeste has recently gone through a first metatarsal surgery to correct a metatarsal adduction. That's more commonly known as a bunion, and it's been about 6 weeks, which is the perfect time to start getting into a little bit of manual therapy to regain some of the lost range coming out of that surgery. Celeste has been doing awesome, as we would expect. But yeah, as we were discussing a little earlier, you are a little stiff through there right now, right?
Definitely, yeah. The pulling up is really tight through the tendons there.
Yeah, big toe extension. Yeah. So let's talk about a technique that we can use and that you can also use on your own at home coming out of a surgery like this, or for any one of the number of other reasons you might have a stiff metatarsal extension or phalange extension at that joint. So let's take a look. Let's have you sit back a little bit here, Celeste. I should also mention, Celeste and I see patients here for yoga-based physiotherapy, which is awesome. We do full assessments and manual therapy, regular physio stuff, but then we also work together to provide yoga-based exercise interventions as well, which is a total blast, a really good time, and really effective too. So if you're the type of person that is more keen on yoga-based exercise, it's a really perfect solution for you, if you're that type of person. So that's kind of a little plug there for us.
Yeah.
All right, let's have you just be comfortable here.
Okay.
And if you take a look, you can see that the cast has come off just recently, right?
Yeah, 2 days ago.
2 days ago, yeah. And it's been 6 weeks, so all the basic healing has happened now. Scar tissue has been laid down. It's still going to be remodeling for several months, which gives us lots of opportunity to modify the sort of anatomical situation here. But it is stiff, and we can see that as we bring Celeste's big toe into extension there, that's really, I'm starting to feel the resistance right there. It's not enough. Really, we need 60 degrees probably of extension for you to have normal mobility that would be required for things like walking, running, stairs, especially going downstairs.
Right, that's the hardest.
Yeah. So a great technique that you can do right off the bat is some joint tractioning, which looks like this. What you're going to do is basically we're trying to separate the two bony segments across the joint. The joint's here, and we're just trying to give a gentle separation of those two joint surfaces, okay?
Scary.
So I'm gonna be gentle,
but
okay?
I trust you.
Yeah, and just you tell me if there's any discomfort. I want this to feel good, not bad. You should come out of this thinking that feels better, not thank goodness that's over, right?
Okay, good.
So we're gonna firmly grasp on both sides, and then you're just gonna give a gentle traction. I'm pulling in this direction on the big toe. And I'm really grasping around the sort of first part, the first bony segment of the big toe. It's that, okay, right?
Good. No pain whatsoever.
Good. So you're gonna hold this for about 30 seconds to 2 minutes. If you really wanna sort of get a little bit more advanced, you can apply the traction and then extend up a little bit too.
Okay.
And you can do this to yourself. So let's have you try that. Come into like a cross-legged position here. Okay, good. Oh, that's an excellent cross-legged position. Better than my cross-legged position.
It's actually my worst one. It's been 6 weeks since I've really noticed.
So yeah, the way you'll grasp is, let's have one hand grasping along here. So let's have this one here.
This.
So this one, let's go here.
Okay.
Yeah. And then the other one right across there.
Right there.
Yeah.
Okay.
Just be firm, be comfortable, and it takes practice too, right? Just get comfortable with yourself. And you're just giving yourself just a gentle pull, right? Okay. And you should be able to feel a little bit of separation in there. And actually, like if you have any sort of,
I think I might do that.
Yeah. Yeah, and there's different things that are going to work for you, right? I mean, experiment with the type of grip. Yeah, there you go. There you go. You can feel that, right? And it should feel similar to what I was doing with you. So there you go. Physiotherapy you can do on your own. Hold that for 30 seconds to 2 minutes, right?
Okay, that feels really good.
Good. Yeah.
Yeah, that feels really good.
So there's step one of a quick and dirty technique you can do on your own. This type of stuff applies across any joint problem, right? You can use these same basic techniques in all kinds of areas. It just so happens to work in the first metatarsal joint here for our case. So that's part one of our video. I think we're going to do the second part of this, so we'll catch you again in the next video. Try that technique on your own. James Braithwaite, Celeste Shirley.